let's talk about this. Why the push now? What you're saying here makes a lot of sense to people. What brought this press release on, and what are you hoping for?
Well, we've actually been talking about this. That this isn't anything new. This isn't something that we just addressed recently. Matter of fact, even before the shutdown happened, early in September, I signed on to a bill that dealt with this cliff that we're looking at the end of this year. But it's important to note first how we got here. These subsidies were passed during a COVID era package by Democrats, and they themselves set this deadline to expire at the end of 25. So this isn't a Republican-created issue. This is when the Democrats had majorities on both sides, and they passed this legislation with this cliff at the end of the year. So we've been tracking this for a long time, which is why I signed on to legislation earlier in September, like I said, that dealt with it, gave it a temporary extension so that people wouldn't have the rug pulled from under them, and they could actually continue with their same budget on protecting themselves with health insurance. So we've been talking about this for a while. Of course, the shutdown came and it stalled everything. Then the Democrats are claiming this is their reason for the shutdown. Well, now what we did this week, just a day or two ago, is send a letter to Speaker Johnson. First of all, establishing the fact that this is a Democrat-created shutdown. The healthcare conversation shouldn't be part of the actual shutdown. We were having these discussions before, and we need to continue to have them. So we need to reopen the government so that we can go back to those conversations and make sure that people don't get shocked by increased premiums at this point.
So when you look at the solutions in your mind, what are the real solutions? You talk about the gamesmanship, which I agree with you. There's a lot of political gamesmanship that's happening. But what are the real solutions that we can get to once the government's open?
So this is one of the first things that we have to tackle. When they expire at the end of December, we're going to be looking at, we would be looking at a very tough situation for families. Like you were saying right before, healthcare cost is up. Now we have to look for, it's kind of like two ways there. One is an immediate solution to the cliff that we have at the end of the year, which is why I've been supportive of a temporary extension, because big healthcare policy is not going to get solved in a few weeks, especially when the shutdown takes longer and longer and eats more and more of the year. That's not going to be able to happen. And we kind of could foresee that happening either way. So we have to look at that. And then we also have to look at the long term. It's not just increasing subsidies to cover the high cost of healthcare. It's making sure that we're working to lower the cost of healthcare. And that's where we have to come in and really roll up our sleeves and go to work on this. A lot of Arizonans depend on this. A lot of people around the country depend on this. Republican, Democrat, Independent, it doesn't matter.
All right. We just lost the congressman. We're going to try to get him back here in a second. Hopefully. There he is. Okay.
Oh,
we lost you for a second there, Congressman. We had a black screen there for a minute. Let me ask about those solutions you're talking about. What is it that you believe can help drive down healthcare costs? What are some of the real things that can be done to drive down the costs?
So we're looking at transparency. We're looking at an open market and competition, things that Republicans have been supporting for a long time. It's looking at what has worked with the exchange program and what hasn't worked. Now, I can actually speak about this from a little bit of a personal experience. When you're a member of Congress, you don't have an option of a healthcare plan except being on the exchange, on the ACA. So I have a personal experience with it as well. My family and I do now. This is our first time that we're on this program. So every member of Congress that chooses to have this healthcare plan are on it. That's the only healthcare plan that we're offered, unless you're getting coverage from the outside somewhere else, like veterans do or others through their spouses. So we were able to really come together and say what is working, what is not working. But the reality is that what we have here, we had a 7-week CR to Thanksgiving. Well, it's already been over 3 weeks on that. We're on day 22 of the shutdown. So we've already lost 22 days of that. So I think Senator Thune was quoted on this saying, we're going to have to look at passing on, if we're going to vote on another CR, now at this point, the 3 weeks that we have left on this one may not be enough. So Democrats in the Senate and Republicans are voting on another measure tomorrow. We'll see what happens. If they can pass something to pay federal workers, then we'll be going back to Washington and to vote on that on the House as well. And then, we'll be able to actually start on this.
So, do you want to comment on the Attorney General Chris Mays in Arizona suing the Speaker of the House, Mike Johnson, to swear in Representative-elect Adelita Grajova?
Well, listen, our Attorney General just seems to love these publicity stunts, and she's done this before, of course, suing she loves suing Republicans. I think that she's done that 28 times with President Trump. And thankfully, she's not a very good attorney. Those lawsuits are all over the place. And now she's decided to sue the Speaker of the House over this. Listen, we've been clear on this. I'm a neighbor with this district here with the Grijalva district, the former Raul Grijalva, now Adelita Grijalva district. We want her to get sworn in. I want the rest of the community in my area in Southern Arizona to have a voice immediately. Had the Democrats not shut down the government, she would have already been sworn in. The Speaker has been clear on this. The government is shut down. We need to get back to work. The Democrats need to open the government so that we can do this. We can do the work on the ACA. We can do all the transparency that needs to happen in so many areas across the board. That we need to reopen the government. So this is a fact of that action by the Democrats, and we need to go back to Washington, swear in Adelita, of course, and go to work.
So let's talk about a bit of the back and forth that's happened with you and Senator Gallego recently. And was it him that challenged you to a town hall debate somewhere? Is there the possibility that could happen? Because I'm telling you right now, I want to referee that moderate that debate. Is it possible? Would that be something you'd be interested in, having the constituents hear from both sides of this issue from the two of you?
Well, listen, what Ruben does immediately after he gets cornered on an issue, like I've been on him for sure. And this all sparked because he is voting to shut the government down while not taking his own, not withholding his own pay, which a lot of people have problems with. I mean, gosh, I don't know how his own team feels about this, but if your boss was not withholding this pay when the team is not getting paid, not to mention troops at that time and Border Patrol agents, well, thankfully, President Trump fixed all that and was able to temporarily find money to be able to pay them. But Ruben decided to not withhold his pay in spite of him voting for the shutdown. So I thought that was wrong, and I called him out on it earlier in this whole process. Well, he didn't take that well, and of course, he started jabbing back, and we went back and forth a little bit on social media. Well, he was given the opportunity again to rectify his own actions, and he says, I'm considering it. So I called him out on that again. His hypocrisy, his lack of leadership, lack of character that we've known for a long time, but now it's in full display in more than one way. So, of course, he calls for, I'm accusing him exactly of that, just doing publicity stunts and these kind of things. And then he comes back with the idea of this town hall. What my message to him is like, go to Washington, do your job, open the government, let's go to work. And then, things need to get fixed. And he's over here sitting, being a Twitter warrior. So he just needs to get to work.
Do you believe, are you optimistic at all that they're going to get together in the Senate in this next vote and do something so that you guys can go back to work? Or are you fearful that this is going to carry on even longer? Because it's been a long time and people are starting to get nervous about SNAP and other things that are going to be shut down. Are you nervous about that, or do you think something's going to happen?
Well, it does. Those are some of the issues that they do keep me up at night. I went to the food bank here in Southern Arizona and met with the CEO there and her leadership staff. We talked through several issues. We've been tracking the WIC payments. This is something that absolutely has to be addressed when you're dealing with women, infants, and children that would be suffering from this. Again, President Trump found a temporary solution for this, actually moving tariff money around to be able to cover this. But where's the outrage on those voices from our friends on the other side about WIC payments possibly not going through? There was speaking of the same topic, actually, there was an interview that Ruben Gallego was on that they asked him, what do you say to the employees that are not getting paid right now, or the WIC recipients? And he said, well, it's something along the lines like, well, this really does suck. And I'm sorry we're putting you through that situation. He's acknowledging that they're putting people through this. So I want to know where the outrage is in all this. And like we're demonstrating, I am worried about these women and families and kids not getting the money they need for food. So, and also the troops skipping a payment. They weren't skipping. They didn't skip the one on the 15th, thanks to President Trump. But what's going to happen to the one at the end of the month? So all these things are real issues that hundreds of thousands of federal employees are facing right here in Arizona.
Congressman, it's always good to catch up with you. I appreciate the words, and let's hope that this gets settled soon. And the next time we talk, you guys are back in D.C., back working.
You got it. Looking forward to it. Thanks, Mike.